Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
A nurse teaches a client experiencing heartburn to take 1.5 ounces of Maalox when symptoms appear. How many milliliters should the client take? Blank ml. The correct answer is 45 milliliters. 1 ounce equal to 30 milliliters. You multiply 30 by 1.5. You get 45 milliliters. A nurse is caring for a client who has just returned from surgery to treat a fractured mandible. Which of the following items should always be available at this client's bedside? Select all that apply. 1. Nasogastric tube. 2. Wire cutters. 3. Oxygen cannula. 4. Suction equipment. 5. Code cart. The correct answers are 2 and 4. Following surgery for a fractured mandible, the client's jaws will be wired. The nurse should be prepared to intervene quickly in case the client develops respiratory distress or begins to choke or vomit. Wire cutters or scissors should always be available in case the wires need to be cut in a medical emergency. Suction equipment should be available to help clear the client's airway if necessary. It is not necessary to keep a nasogastric tube or oxygen cannula at the client's bedside. Cardiopulmonary arrest is unlikely, so a code card is not needed at the bedside. The nurse is preparing to teach a client with a peptic ulcer about the diet that should be followed after discharge. The nurse should explain that the client should eat which of the following? 1. Bland foods. 2. High-protein foods. 3. Any foods that are tolerated. 4. A glass of milk with each meal. The correct answer is 3. Diet therapy for ulcer disease is a controversial issue. There is no scientific evidence that diet therapy promotes healing. Most clients are instructed to follow a diet that they can tolerate. There is no need for the client to ingest only a bland or high-protein diet. Milk may be included in the diet, but it is not recommended in excessive amounts. Since the diagnosis of stomach cancer, the client has been having trouble sleeping and is frequently preoccupied with thoughts about how life will change. The client says, "I wish my life could stay the same." Based on this information, the nurse should understand that the client, 1. is having difficulty coping, 2. has a sleep disorder, 3. is grieving, 4. is anxious. The correct answer is 3. The information presented indicates the client is grieving about the changes that will occur as a result of the diagnosis of gastric cancer. The information does not indicate the client is having difficulty coping or experiencing insomnia. The client is not demonstrating signs of anxiety. 1 month following a subdural gastrectomy for cancer, the nurse is evaluating the nursing care goal related to nutrition. Which of the following indicates that the client has attained the goal? The client has 1. Regain weight loss. 2. Resume normal dietary intake of 3 meals a day. 3. Controlled nausea and vomiting through regular use of antiemetics. 4. Achieved optimal nutritional status through oral or parenteral feedings. The correct answer is 4. An appropriate expected outcome is for the client to achieve optimal nutritional status through the use of oral feedings or total parenteral nutrition. TPN may be used to supplement oral intake, or may be used alone if the client cannot tolerate oral feedings. The client would not be expected to regain lost weight within 1 month after surgery, or to tolerate a normal dietary intake of 3 meals a day. Nausea and vomiting would not be considered an expected outcome of gastric surgery, and regular use of antiemetics would not be anticipated. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanursguide.com. Back to the questions. A mother asks, "How should I bathe my baby now that he's had surgery for his inguinal hernia?" Which of the following instructions should the nurse give the mother? 1. Clean his face and diaper area for 2 weeks. 2. Use sterile sponges to cleanse the inguinal incision. 3. Give him a sponge bath daily for 1 week. 4. Give the infant full tub baths every day. The correct answer is 3. The incision must be kept as clean and dry as possible. Therefore, daily sponge baths are given for about 1 week postoperatively. Cleaning the infant's face and diaper area should occur at least daily and continuously, not limited to a 2-week period. Because this type of surgery results in a wound that heals through primary intention, the skin will heal and cover the wound in 2 to 3 days. Therefore, it is not necessary to use sterile gauze to cleanse the incision. Clean technique is acceptable because the incision must be kept as clean and dry. Full tub baths are inappropriate. An infant with Hirschsprung's disease is to be discharged 1 or 2 days after surgery to create a colostomy. After teaching the infant's parents about the overall effects of their infant surgery, the nurse determines that the teaching has been effective when the parents state which of the following? 1. His abdomen will be large for a while. 2. When he's ready, toilet training may be difficult. 3. We need to limit his intake of dairy products. 4. We will give him vitamin supplements until he is an adolescent. The correct answer is 2. Toilet training is commonly more difficult for children who have undergone surgery for Hirschsprung's disease than it is for other children. This is because of the trauma to the area and the associated psychological implications. Abdominal distension is an early sign of infection, and therefore the parents need to report it to the primary care provider. Typically, dietary restrictions are not required. Usually, the infant is placed on an age-appropriate diet. Vitamin supplementation is not necessary if the infant's dietary intake is adequate. Which of the following would be appropriate for the nurse to identify as a priority nursing problem for an infant just admitted to the hospital with diagnosis of gastroenteritis? 1. Pain related to repeated episodes of vomiting. 2. Deficient fluid volume related to excessive losses from severe diarrhea. 3. Impaired parenting related to infant's loss of fluid. 4. Impaired urinary elimination related to increased fluid intake feeding pattern. The correct answer is 2. Given this infant's history of gastroenteritis, the priority problem would be fluid volume deficit. With gastroenteritis, vomiting and diarrhea occur, leading to the loss of fluids. This loss of fluids is problematic in infants because a higher proportion of their body weight is water. Pain is not a priority problem, although the nurse should continue to assess the infant for pain. There are no data to indicate impaired parenting. Impaired urinary elimination is related to the infant's fluid volume deficit resulting from vomiting and diarrhea associated with gastroenteritis. If the infant's fluid volume deficit is not corrected, then this nursing diagnosis may become the priority. On a home visit following discharge from the hospital after treatment for severe gastroenteritis, the mother tells the nurse that her toddler answers no and is difficult to manage. After discussing this further with the mother, the nurse explains that the child's behavior is most likely the result of which of the following? 1. Beginning leadership skills. 2. Inherited personality trait. 3. Expression of individuality. 4. Usual lack of interest in everything. The correct answer is 3. The no behavior demonstrated by a toddler is typical of this age group as the child attempts to be self-assertive as an individual. The negativism does not demonstrate an inherited personality trait or disinterest. Rather, it reflects a developmental task of establishing autonomy. The toddler is attempting to exert control over the environment. It is too early to assess leadership qualities in a toddler. Approximately 15 minutes after birth of a viable term neonate, a multiparous client has chills. Which of the following should the nurse do next? 1. Assess the client's pulse rate. 2. Decrease the rate of intravenous fluids. 3. Provide the client with a warm blanket. 4. Assess the amount of blood loss. The correct answer is 3. A chill shortly after birth is a common, normal occurrence. Warm blankets can help provide comfort for the client. It has been suggested that the shivering response is caused by a difference between internal and external body temperatures. A different theory proposes that the woman is reacting to fetal cells that have entered the maternal bloodstream through the placental site. Assessing the client's pulse rate will provide no further information about the chill. Decreasing the IV rate will not influence the length of time the client trembles. Assessing blood loss is a standard of care at this point postpartum, but has no correlation to the chill. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.